Hey everybody. Sorry it looks a little um, blurry because I'm on my laptop. But I'm here to teach you about naloxone, otherwise known as Narcan. So I'm going to take you through some frequently asked questions about overdose and naloxone and how to tell if someone's overdosing, what to do when someone's overdosing, um, how to get Narcan and fentanyl and xylazine testing strips. I'm going to talk about what naloxone is, how it works, how you give it to someone. Um, and then we're going to just talk about prevention, overdose prevention, and things like that. So let's just get into it. So let me start with my screen. Share screen. Okay. This I can get rid of. Okay, get rid of that. Ah, where's all my stuff? I can't see. So again, hi there. My name's Cindy, Cindy Berger from My Journey. I'd like to welcome you to Safe Project's virtual opioid overdose response training. We're going to proceed with a couple of modules in this training, and we're going to learn about how you can utilize naloxone to intervene in an opioid overdose. So this training is intended for the use of naloxone in everyday situations. And I will add a disclaimer, some states will require an additional quick training when obtaining naloxone from a pharmacy. So laws and policies do vary. Another disclaimer, if someone you know is currently experiencing an overdose, please call 911. Okay, so. All right. Now we're going to get into the screen sharing and I'm going to start a video.
Thank you for taking this SAFE Project online course and offering us some of your time to learn how to save a life with naloxone. The topics we will cover in this training include the following. 1. What is harm reduction? 2. What are opioids and how do they work? 3. What is an overdose and how do we recognize one? 4. What is naloxone and what makes it effective? 5. How do we save a life with naloxone? We will offer some additional resources and ways to get involved with SAFE Project along the way. As you navigate through this course, please be sure to complete all of the modules, surveys, and evaluations.
Let me get back out of here. Now we're going to talk about what harm reduction is.
To begin, we want to talk briefly about the motivation and approach for this online experience. Many of us have grown up in a culture where drug use and people who use drugs are judged and stigmatized, so this course may require a reframe of sorts. We have all heard of phrases like just say no, and may have witnessed DARE educational seminars. However, studies have shown that abstinence-only approaches are ineffective. It is important that we acknowledge the presence of substance use in our world and seek to mitigate the potential harms of substance use for those who participate. Today, in the spirit of saving lives, we are approaching through the lens of harm reduction. So that we all have a firm grasp of what harm reduction is, let's review a quick definition, goals, and principles of the topic. According to the Harm Reduction Coalition, harm reduction can be defined as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement of social justice built on the belief in and respect for the rights of people who use drugs. In addition to this definition, Harm Reduction International offers some simple principles and goals of harm reduction that we will incorporate into this training. Principles of harm reduction include respecting the rights of people who use drugs or engage in activities we deem as containing risk. Harm reduction is fundamentally grounded in principles that aim to protect human rights and improve public health. Treating people who use drugs, along with their friends and families and communities, with compassion and dignity is integral to harm reduction. The second principle is a commitment to evidence. Harm reduction policies and practices are informed by a strong body of evidence that shows interventions to be practical, feasible, effective, safe, and cost-effective in diverse social, cultural, and economic settings. Most harm reduction interventions are easy to implement and inexpensive, and all have a strong positive impact on the individual and community health. Third, a commitment to social justice and collaborating with networks of people who use drugs. Harm reduction is rooted in a commitment to addressing discrimination and ensuring that nobody is excluded from health and social services they need because of their drug use, their race, their gender identity, their sexual orientation, their choice of work, or their economic status. Fourth is the avoidance of stigma. We accept people who use drugs as they are and are committed to meeting them where they are in their lives without judgment. Terminology and language should always convey respect and avoid stigmatizing terms or attitudes. Stigmatizing language perpetuates harmful stereotypes and creates barriers to health and social services. Still, language changes. If you notice what you believe to be stigmatizing language within this training, please include a note in the course evaluation or contact SAFE Project staff. Harm reduction is grounded in the recognition that many people throughout the world are unable or unwilling to stop using illicit drugs. Therefore, it aims to do the following. First, keep people alive and encourage positive change in their lives. Keeping people who use drugs alive and protecting their health are our most urgent priorities. Harm reduction approaches are facilitative rather than coercive and aim to reinforce positive change in a person's life, no matter how small or incremental that change may be. Second, reduce the harms of drug laws and policy. Harm reduction seeks to improve drug laws, policies, and law enforcement practices so that they are not detrimental to the health and well-being of people who use drugs and their communities. Third, we want to offer alternatives to approaches that seek to prevent or end drug use. The majority of substance use-related initiatives and policies in our country are intended to prevent substance use or to encourage individuals to limit or end their use that they already use. Harm reduction, including topics within this course, intends to expand our substance use resources and discussions to include people actively using drugs and the diversity among them. These conversations then also support and positively impact our prevention, treatment, and interventions resources in a way that intends to make them more humane and able to meet complex needs. We all engage in activities every day that contain some level of risk, and we have often found shared solutions for minimizing those risks. Some examples of harm reduction in our everyday life can include eating before you drink alcohol, wearing masks in indoor crowded spaces during COVID, the use of seatbelts to lessen the danger of potential car crash or accidents, taking a ride share instead of drinking and driving, or even just driving while tired, condoms or safer sex barriers or birth control to prevent unwanted sexually transmitted infections and or pregnancy. These examples of harm reduction are all around us, and these same motivations have led us to many approaches to reducing unnecessary risks associated with substance use. Some strategies for substance use harm reduction include fentanyl testing strips to equip individuals and groups with more information about their substances, to increase agency and improve safety precautions if they choose to use, reducing the amount
All right, so that was all about harm reduction. Now it's going to get into what are opioids.
An important part of understanding overdose and overdose response is understanding the very fundamentals of what opioids are and how they work. Opioids are a class of drugs that include heroin, is a part of our brain that controls emotions, the brainstem, which controls things that your body does automatically, like breathing, and the spinal cord, which receives sensations from the body before sending them to the brain. As a very simple analogy for how our opioid receptors work, we find it easy to envision a golf tee and a golf ball. Opioid receptors, looking much like the golf tees, are located throughout our brain and body, simply waiting to be utilized. When a golf ball, or an opioid, lands on a golf tee, or an opioid receptor, the opioid receptor becomes activated and starts sending signals. Signals will keep being sent as long as the golf tee is holding the golf ball. If too many opioids trigger too many receptors, that's when things get dangerous. We'll return to this analogy in the naloxone section. It may be worth taking a moment to think to yourself what opioids you are aware of. If you were to hear that someone is using opioids or experiences an opioid overdose, what substances come to mind? Are you aware if you've used opioids in the past? On this slide, we see many common examples of opioids, as well as 3 general classes that they fall into. First, underlined in the reddish orange are the generally prescribed pain reliever medications. These include oxycodone, fentanyl, codeine, and morphine. Many of us have come across prescription opioids after experiences such as surgery, significant injury, or even childbirth. Some opioids are particularly formulated for end-of-life or cancer-related pain. Additionally, we have underlined in purple medications for opioid use disorder, such as methadone or buprenorphine. These recovery medications, which pair the pain-relieving properties of opioids with safety mechanisms for preventing overdose and/or lessening cravings. These are being increasingly prescribed as pain management tools in their own right, as well as for their use in promoting recovery. Finally, underlined in yellow, we have the opioids that are known for their illicit status, which are heroin and illegally made fentanyl, which do not benefit from the product or market controls of prescription medications.
Okay, that was all about opioids and what they are. Next, we're going to talk about fentanyl safety, what to know, and how to navigate the risk. Actually, no, I'm sorry. We're going to skip over that because it's a 20-minute training, but I may do that in our next meeting. So we're going to talk about overdose and understanding it.
Before we move into talking about saving a life in the instance of an opioid overdose, let's talk about where we are in the overdose crisis and how overdoses occur. In 2021, at least 107,622 Americans died from an overdose. Just 5 years ago, in 2016, we lost 63,600 Americans to overdose. Of the 107,622 overdose deaths, just about 80,000 involved opioids, about 71,000 involving fentanyl specifically. Nationally, a fatal overdose occurs, on average, every 5 minutes. Since the year 2000, more than 1 million Americans have died from a drug overdose. That's more than the people that live in Austin, Texas, over twice as many people that live in Raleigh, North Carolina. For further comparison, Washington, D.C. and Denver, Colorado both have approximately 715,000 residents. While these statistics can be jarring and even scary, it is important to recognize that tools like naloxone and additional harm reduction measures are highly effective at reducing these numbers. It is tools, rather than fear, that empower our communities to solve these issues, turn the tide, and save lives. This tools over fear approach is particularly important in the current landscape of fentanyl. With fentanyl being such a large part of the modern conversation around overdoses, there are a few quick things to know. Fentanyl is typically 50 to 100 times stronger than morphine, designed and approved for cancer and later in life pain. However, most recent cases of fentanyl-related harm, overdose, and death in the US are linked to illegally manufactured and non-prescribed fentanyl. Illicit fentanyl is still fentanyl, but due to the lack of quality controls and safety mechanisms that we see with substances distributed within the legal markets, like many illicit substances, there is considerable risk inherent in its use. An increase in fentanyl availability and contamination has contributed to a 12 times increase in synthetic opioid overdoses from 2013 to 2019. The greatest risk posed by fentanyl comes from its relative potency combined with unintended or uninformed use, particularly among pressed pills and powder substances. It is unfortunately the reality that when folks buy or ingest drugs in our current environment, there is a risk of fentanyl being present. In addition to carrying naloxone, it is recommended that people who use fentanyl also use fentanyl test strips to increase their awareness of what substance they are using. Laws regarding fentanyl test strips vary by state. It is important to note that fentanyl has replaced heroin as a primary illicit opioid over the past few years. Fentanyl, when used in an informed manner, will not necessarily cause an overdose. The heightened risk comes from a very small amount of fentanyl needing to be present to cause an overdose. Risk of overdose strongly correlates to knowledge of the presence of fentanyl and awareness of fentanyl contamination. This can be addressed through fentanyl test strips and drug education. To understand how overdoses happen, we simply need to refer to our previous slide regarding the action areas for opioids. In the brainstem, opioid receptors regulate breathing in the respiratory system. When opioid receptors are activated, they begin to signal to our lungs that they need to slow down breathing. So opioids in high doses can oversaturate our opioid receptors, create too much of the slow breathing message, and cause respiratory depression and death. In other words, breathing can slow or stop to a point where death or permanent damage is possible. Luckily, to save a life, we just need to stop those chemical signals and allow the body to return to the naturally occurring breathing rhythm. When it comes to harm reduction and preventing overdose, it can be valuable to understand some of the greatest risk factors for experiencing an overdose, why they are risk factors, and some things we can do to address them. Individual risk factors include reduced tolerance, particularly following detoxification, release from incarceration, and cessation of treatment. A primary function of our brains is to maintain balance, or what we call homeostasis. Our brains adapt to changes in our environments and develop new baselines for what makes us feel normal. When we feel the effects of a substance, it is because we are moving away from our baseline. If I use the same substance regularly for an extended period of time, my brain will correct for that change, and I will need to use more of that substance in the future in order to feel the effect that I achieved previously. The gaining of tolerance is a relatively linear process that most who use drugs are skilled at navigating. Simply, if we are not achieving the intended result, we understand that we may need more. On the other hand, while tolerance builds in a largely predictable manner, when we take time away from a substance we are tolerant to, our tolerance can drop very rapidly. In the case of opioids, it can take less than a week to lose one's tolerance. Tolerance also serves as an overdose prevention mechanism, so when we lose our tolerance after a period of abstinence and return to use, if we use a similar amount that we were using previously, our brain's ability to cope has largely disappeared and overdose is likely. This risk is particularly relevant for those who may return to use after a period of abstinence-based recovery, a period of incarceration, or even a short spell in treatment. For reference, research shows us that individuals released from incarceration are between 40 and 120 times more likely to experience an overdose than the rest of the population for their first 2 weeks post-release, depending on their drug of choice and geographic location. Second risk factor is injection as method of use. Injection contains considerable risk of overdose, in addition to the previously mentioned risks of bloodborne illness and infection. Once a substance is injected, it cannot be removed in the way ingested substances may be able to. When individuals inject, they are likely to use the full intended dose at once, which can be risky if we are not completely sure of the potency or purity of what is being injected. So, it is advised that those who inject drugs start slow, as you can always use more if the desired effect is not achieved, or consider alternative ways of use. Another risk factor is using prescription opioids, particularly those taking higher doses. Individuals who have access to opioids via prescription, particularly those using at high doses over extended periods of time, should be informed about Narcan and overdose response, as should their friends and family. There is inherent risk involved in high dosage opioid use, and it is important to navigate. Finally, using opioids in combination with other sedating substances. When we use more than one drug at a time, there are often interactions between those drugs that can change the way our bodies react. Many of us are familiar with conversations regarding drug interactions through conversations with healthcare providers when we may be considering or receiving a new prescription. One of the highest risk drug interactions comes when we use multiple depressants at once. So as an example, when we use alcohol in an opioid or a benzodiazepine like Xanax, overdose risk is very high. While opioids work to depress our nervous system and therefore our breathing, when we add another depressant like alcohol, these depressant side effects compound and often multiply each other. In 2019, nearly half of all drug overdose deaths involve multiple drugs. This, in part, illustrates the risk that comes when we use fentanyl without intending to. We may already be using another depressant and therefore creating risk of overdose much higher than there would be from using either substance on their own. One of the greatest ways to reduce the risk of fatal overdose is to ensure that folks do not use drugs alone or in a location that could lead to them blocking a door and preventing the access of individuals looking to respond. NeverUseAlone.com is an available resource and hotline for people using drugs to have someone check on them while they are using and call for support in case of emergency. If you're going to be ready to respond to an overdose, you first need to know what an overdose can look like. We operate off of 7 main symptoms, not all of which need to be present for an overdose to be occurring. Rather, there are things to look out for, and there are signs that our bodies are entering a respiratory emergency. After all that we've learned in this course, these symptoms may be self-explanatory. First, individual is unresponsive, even if you shake them lightly, shout their name, or do what is called the sternum rub. We'll talk more about the sternum rub in a later section. Second, their breathing slows or stops. Loud gurgling or snoring may also be present as someone falls into an overdose. Third, lips and fingernails, places in our body with a lot of small blood vessels, begin to turn blue or gray. Fourth, the skin will also turn pale or ashen or clammy, meaning damp or sticky to the touch. Fifth, they may have a limp body. Six, they may be vomiting, but to clarify, vomiting as a symptom, especially from an opioid overdose, will look much different than vomiting we may see with other illnesses, due to this vomiting being with an absence of coughing or breathing. Seventh, the individual will have a weak pulse or no pulse. We often imagine that we will be able to see an overdose coming. However, with polydrug use, or the use of more than one drug at once, the potential presence of fentanyl, overdoses are not always easy to predict, and their length of onset time can vary widely as well, from a few minutes with fentanyl to a few hours with extended release medications. You may notice that these symptoms may also signal other life-threatening emergencies. With that in mind, we recommend that we always enlist emergency medical support when responding to an overdose, but that we also use naloxone if we are unsure if we are intervening in an opioid overdose, since naloxone will not cause harm, even if it is not needed.
All right, so that was a little long, but it's important. And now we're going to get into the actual Narcan training. And I'm going to be
With
talking
all this
a little bit
information
about it
comes
too.
great news. We have a tool that reverses opioid overdoses and saves lives. This tool is called naloxone. Naloxone is an opioid overdose reversal drug and is purely an opioid antagonist, meaning when opioids attach to opioid receptors, naloxone attaches more strongly to those receptors without activating them, kicking out the activating opioid and blocking the receptor for 30 to 90 minutes. Earlier in this training, we had referenced opioid receptors as golf tees and opioids themselves as golf balls. In this analogy, naloxone is a swing-happy friend of the driving range. It goes around using its stronger power to knock opioids off of the receptors. Not only that, it then protects the receptors from further activation for a while. Luckily, naloxone is easy to administer and has no potential for misuse. Nasal spray naloxone is absorbed through mucous membranes in the airway, not through inhaling, so active breathing isn't necessary for it to be effective. No matter how strong an opioid is, naloxone can be highly effective. Many of us have heard stories and reports of individuals needing dozens and dozens of doses of Narcan or naloxone to be revived from an overdose, and therefore many have claimed that fentanyl and similar opioids are naloxone resistant. Luckily, this is not true. How groups have arrived at this myth is understandable, though. Fentanyl works much more quickly than other opioids, so respiratory depression sets in more suddenly and more quickly starts the window for effective response. As long as we use naloxone or otherwise introduce oxygen within this important window, individuals can survive an overdose, even from the most powerful of opioids. Naloxone is part of a larger overdose prevention strategy. Naloxone is not new, but the public use of it is more recent in response to increased overdose deaths. Naloxone nasal spray, often referred to as Narcan, was approved by the FDA in 2015, and as of 2020, all 50 states have naloxone access laws or standing orders, removing the need for a prescription to obtain naloxone. There are three most commonly available types of naloxone that folks may come across. First is the injectable generic. This has a syringe and a vial and is the cheapest option. Second is the intranasal atomizer generic, which assembles a syringe with an atomizer that is placed in the nostril and assembly is required. Third is the nasal spray, often referred to by the brand name of Narcan, which we will be talking about more here in a minute. Insurance coverage varies, so if you're looking to purchase using insurance, we recommend contacting your insurance provider. Additionally, be on the lookout for potential future shifts towards naloxone becoming an over-the-counter medication. Each of these types of naloxone are effective and are not better than one another. Instead, they give us multiple options for accessibility and methods of use to best meet the needs and comfort of those who may use them.
Okay. So, let's see what's next. Rules. Okay, so then this is also the part where Well, I'll talk about this first because they didn't really discuss it. Um, so they discussed how you can tell if someone's overdosing. We all know what it looks like. Um, Trigger warning. Sorry, I said that too late, but that was always a trigger for me. Um, so things you can do if someone is overdosing is obviously check if they're breathing. If they are breathing, they're conscious and they can walk, it may help to get them up and moving. Splash water on their face, use a cool wet cloth on their face, keep checking their breathing, and obviously call 911. If they are not breathing or breathing slow, like less than one breath every 5 seconds, you need to breathe for them. So roll them on their back, tilt their head back, remove anything in their mouth like food, gum, or vomit. Take a deep breath and make a seal with your mouth over theirs. And you're going to blow into their mouth 2 breaths first and 1 breath every 5 seconds until the paramedics get there. Also, doing chest compressions can also help. So if you have naloxone, also known as Narcan, give a few breaths, like I just explained. Then you're going to inject or spray the Narcan, and you're going to keep breathing for them until the Narcan starts to work. If they aren't breathing on their own in 3 minutes, you need to give a second dose. Narcan works on all opioids, including fentanyl, acetylfentanyl, acrylfentanyl, carfentanil, U-47700, and others. It can take sometimes more than one dose. Give one dose to start and breathe for them. It's rare that someone needs more than 2 doses, but it is possible. If someone also took benzos, they may still be out of it or even unconscious once the Narcan starts them breathing, but more Narcan won't help them as it does not reverse the effects of benzos, and it also does not reverse the effects of stimulants either. It has no bearing on speed, cocaine, or any kind of stimulant like methamphetamine or cocaine. Um, Patient Millie. Symptoms of stimulant overdose is the shakes, sweating, rapid pulse, vomiting, foaming at the mouth, unable to talk or walk, pressure or tightness in the chest, seizures, unconsciousness, no breathing, and no pulse. They need medical attention as soon as possible if they have symptoms of a heart attack, stroke, or seizure. And sometimes fentanyl has been found in some meth and coke, so it's a good idea to have Narcan on hand, even if you don't use opioids. So the video went over and discussed what naloxone is. Um, Naloxone is the generic name for Narcan, and the other brand name for Narcan is also called Evzio, I think if I'm saying it correctly. So, when someone overdoses on opioids, opioids include heroin, morphine, fentanyl, the carfentanil, the U-47700, methadone, oxycontin, Vicodin, Percocet, Opana, Dilaudid, and other pain medications. Narcan can restart their breathing if they get it soon enough. So, how does naloxone work? It's either injected into a muscle or it's sprayed into the nose, like, depending on what type you have. The type that I was sent was the nasal spray. So it does not work if it's taken by mouth. What it does is it blocks the receptors in your brain to which the opioids are still attached. It starts to work in 3 to 5 minutes, and it lasts for around 30 to 90 minutes. It really just depends. While you're waiting for it to work, you must keep breathing for the person who has overdosed. So, as I was saying, how do you give naloxone to someone? It can be injected into a muscle. Um, you're going to inject the entire contents of the bottle. It's usually 1 cc. And then you're going to wait 3 to 5 minutes while you continue to breathe for them. And like with what I said earlier, usually 1 cc is enough, but sometimes you're going to need a second dose if they don't wake up right away. And obviously make sure you call 911 so the paramedics can be on their way in case there are other problems. And it lasts 30 to 90 minutes, so the overdose can restart once it wears off. So it's always best to call 911. And there are certain laws. I have the link for that. Like the citizen thing, calling and getting in trouble if you're using too. Every state is different, but I know Pennsylvania, it doesn't matter if you have drugs sitting there in front of you, you cannot get in trouble for calling 911 for someone that's ODing. But anyway, off topic. There's no more treats up there, Millie. I gave them to you. So the nasal Narcan spray comes in a white box marked Narcan nasal spray, like I showed you. This type is stronger than the muscle naloxone, and so that also means that withdrawal symptoms may be more severe. Usually a second dose is not needed, but like I said, sometimes you have to use it. When you push the button, you're going to use the whole content, the whole thing. And you want to make sure that you have it in the person's nose first. You don't want to do a test spray. Just put it up their nose and push the plunger. You probably won't hear or see the spray. There's also Narcan that they mentioned that comes in a long vial that you have to screw together, and it's in the back of a syringe. So this type is less common, but still used in some places. There's also an auto injector, like an EpiPen, which you would press against the person's. I'm pointing to my arm, but it's actually their leg, and then you push down for 5 seconds. The device also talks to you. I've seen one before. It's pretty cool. It is super easy to use, but it's very strong. Like it's equivalent to 5 doses of the muscle naloxone. So the person who overdosed may get more sick from the withdrawal. So another important thing to discuss is how you can get Narcan. So if you use opioids yourself or are likely to witness an overdose, you can get injectable naloxone free of charge at a needle exchange site. I have the address. Millie, please. And the website for the details. So the training on overdose prevention and response and instruction on how to give naloxone takes 5 to 10 minutes. So you'll be able to get injectable naloxone to take home with you. You can also get naloxone at any of their van syringe supply sites. So for anybody that doesn't obviously live in Pittsburgh, I'm going to talk about other places you can get them. Pharmacies can sell naloxone or bill your insurance by a standing order prescription. So that means you don't have to see a doctor. You can ask your local pharmacist if they participate in this standing order. Also, certain jails are now making naloxone available to people on release from jail if they request. Anybody else in Pittsburgh, the EMS will also leave a naloxone kit when responding to an overdose. Some hospital emergency departments provide take-home naloxone to someone who has overdosed, and some substance use treatment programs give out Narcan. Service providers who want to have Narcan on hand can purchase naloxone at a pharmacy, like a fire extinguisher. This is part of the cost of having a safe work site. So anybody watching this, if you want to have it on hand, you can purchase it at a pharmacy. There's also a website called Overdose Prevention Project. So now, if you can't access naloxone through pharmacies, syringe exchange programs, or by any other means, you can contact Next Distro, which is where I got this stuff from. The nasal Narcan, I got 4 of them, and a couple of the xylazine and the fentanyl strips, which obviously I'm not going to be using these, but I thought it was cool that they sent them. So where was I? This might be a dumb question, but I'm going to mention it. Is it legal to give someone Narcan? Yes. And like I said, every state has its own laws and whatever about it. But Pennsylvania, like where I live, Narcan is allowed to be prescribed directly or by a standing order to anyone who might witness an opioid overdose. A person acting in good faith and with reasonable care is immune from criminal prosecution, civil liability, professional licensing sanction, or review. So, other things to mention, I've heard you should put ice on someone who has overdosed. Is this true? If someone is nodding but can wake up, ice may help to wake them, but it's quicker to rub your knuckles hard on their chest, right in between here. I don't know if you can see me, but or pinch them on their earlobe, finger, or inner arm. Usually, ice just wastes time and creates an unnecessary mess. Another question, what about injecting them with salt water? You should never inject someone with salt water, speed, cocaine, bleach, milk, or anything but Narcan. None of these things will help someone who is overdosing. Some of them may hurt them, and they are all a waste of precious time and a precious life. So, a person, if they stop breathing for as little as 4 minutes, they may have brain injury or death. So, keep this in mind and keep breathing for them to keep them alive. And like I mentioned before, I'm going to mention again, even if you've given them the Narcan, it is still important to get oxygen into their lungs. Sometimes they will start breathing on their own if you breathe for them for a few minutes or give chest compressions. But you have to keep breathing for them until the paramedics get there. So if they aren't breathing and are left alone, they may die. Don't assume that they'll wake up on their own or that the paramedics will find them in time. If no one can stay with them, place them on their left side with their left arm and leg out straight and right arm and leg bent, which is called the rescue position. It looks like that. That way they can't roll over and swallow their vomit. So it's a little easier to breathe in that position. And like I said, if they vomit, it's less likely that they'll choke if they're on their stomach versus if they're on their stomach or on their back. So make sure the ambulance is on their way, they know where to find them and can get to them easily. Tell the 911 dispatcher what they took if you do know what that is. What factors can increase the risk of overdose? Anyone who uses opioids can overdose, obviously. Mixing different drugs together increases the risk, especially mixing opioids with alcohol and benzos like Xanax, Klonopin, Ativan, Valium, and similar medications prescribed for anxiety. So, not knowing the strength of drugs or medication increases the risk. Heroin is often mixed with fentanyl these days, much stronger than heroin. You can't always tell if fentanyl is in the mix. So you can get fentanyl test strips at Prevention Point Syringe Exchange or at Next Distro, and you can test your fentanyl for other substances. So also changes in your tolerance. So like if you use opioids every day but stop for a few days and then you start again, your risk of overdosing increases because your tolerance is lower. Illness that affects your breathing, like asthma, COPD, or emphysema, can also increase the risk of overdose. So again, I'm probably going to make a post after this meeting is over about how you can contact all of these syringe exchange places and Prevention Point if you're in Pittsburgh, and the Next Distro website. Know what Narcan is. We talked about that. So one thing that I thought was cool, but it's kind of crazy because it spells scare me, SCAREME, and it stands for S for stimulation. Can they be awakened? C, call for help if the person is not responsive. A is for airway. Make sure nothing is inside the person's mouth to stop them from breathing. R is for rescue breathing. breathe for them, 2 quick breaths every 5 seconds. Letter E is for evaluate. Are they any better? Can you get Narcan and prepare it quick enough that they won't go for too long without your breathing assistance? And M stands for muscular injection. E is for evaluate and support. Is the person breathing on their own? Is another dose of Narcan needed? Again, Narcan wears off in 30 to 90 minutes, so seek help and comfort him or her so he or she will not use any more drugs until the naloxone wears off. That is the worst thing you can do, is for someone to wake up after having been given Narcan, and the first thing they want to do, because I've been there, is, where's my drugs? I want to use some more. Like, I literally had to be told, Cindy, are you dumb? Like, you just literally almost died and you want to do more drugs. But that's the state, and that's what addiction does. So, okay, so a little bit about the testing strips. It's to test your powders, pills, and rocks. So obviously white powders and rocks can look the same, so you want to test it. Now, I'm not encouraging people to use. However, I want to make this clear. I am not condoning or telling people to use, but if they are using, there are ways to stay a little bit safer than just going in blind and not knowing what you're using. So obviously, fentanyl, we all know, is a strong synthetic opioid. It is like 50, 60 times stronger than heroin, and it sometimes can be confused for other powders, like cocaine or regular heroin or crack cocaine. Street drug supplies are very unpredictable and mistakes happen. You think you can trust your dealer, you've known them for years and they've never screwed you before, but it doesn't matter. Sometimes things change hands and they get stuff from other places and maybe they don't even know. So you always want to be safe regardless, you know. I know that sounds counterintuitive, but if you're using some harm reduction strategies, you can keep yourself a little bit safer and reduce your risk for overdose. So you want to use less, test your drugs, try not to use alone, come up with a safety plan with friends, and have Narcan and know how to use it. So this will be available for replay. It'll be on the YouTube channel. So obviously, if you need to replay it, you can replay it. That's all I wanted to talk about. I don't know, I'm so stuffed up. I was working today, helping someone move their stuff, and it was all dusty, so that probably explains it. But yeah, so any questions, Shotzi, since you're the only one that came?
Hi.
No?
Can you hear me?
Oh yeah, I can.
Okay. I need to watch the whole thing through, but I've already learned some stuff.
Cool.
Just when I came in.
Good. Yeah, I know that the modules are a little bit long, like the videos are a little long, but I went for the abbreviated one because the one that I did for the training was like almost an hour.
Oh wow.
So even with me going through all these short little videos and then talking about it, it's already 8:30. So it will, and I'm just gonna show, here's all the, you would go on to the next distro site and then you would select your location. So if you use drugs or are connected to anybody that does, it says they're in collaboration with 30 harm reduction programs nationwide. Some programs secure funding for statewide distribution. Many operate with limited funds or rely on volunteers and donations, but their primary focus is for people and individuals who use drugs, or around people, that do. So pretty sure they can send it to anybody in the United States.
Looks like I'm covered.
Yep. So that's that site. I'll put everything in a post.
What were the pictures on the states for?
Oh, I think that was, what does it say there? Affiliated state is this color blue. Unaffiliated statewide mailing program. And then if it's in white, like Wyoming, there's no current affiliate. So I think they just mean, let me see. Yeah, I think they can send to everybody, but I don't know what is on Wyoming. I don't know what they mean by unaffiliated. Maybe there's no yeah, you can get it. Pharmacy based, public Department of Public Health. Let's click on Pennsylvania.
I just don't know if I would ever need it because I never leave the house.
Yeah, I don't either. I don't think I'm gonna need it either, but who knows? Like I clicked on Pennsylvania, they have syringe exchange, a telephone hotline, crisis support, Good Samaritan policy. That's what it's called, Good Samaritan policy. So that's what I was explaining earlier. I don't know if you were on for that.
I don't think so.
If you are with someone that's using and they overdose and you call the ambulance, you can't be arrested. You can go to the pharmacy and get them, and then they have what's your state?
Missouri.
Missouri. Okay. Let's click on that.
Echo.
Okay, so you have a Naloxone finder. You also have a Good Samaritan policy, and it looks like you have everything that PA does: crisis support, telephone hotline, pharmacy, and organizing. Like organizations that have it. What was that? First responder, organization, faith-based group, or other entity looking to distribute naloxone. Please use the button, or you can request it. And then it has says find naloxone near you. No cost naloxone is available at a variety of locations across the state, and that's for your state. Use this map to explore the community-based organizations, recovery centers, and Nalox box locations near you. No more deaths. Statewide resource site for individuals seeking naloxone access, treatment resources, and other support. So this is like a really good site for all kinds of resources. And
yeah,
for everybody's state, they can go on here and it tells you all of what they have.
I know it's a big problem around here.
Yeah, I know, it's a shame. Look at 72,000. It's crazy. Says it at the top. In 2020, there was 1,875 identified opioid overdose deaths in the state of Missouri.
Can you put that link somewhere? Yeah.
Yeah, I'm gonna put all that in a post after we get off of here. All their social medias,
awesome.
and their and for the what the hell is it called? Syringe exchange places. So what was Pennsylvania? 5,000, almost 6,000 deaths in 2017 to 5,000 deaths. Oh, it went down to 2018. There's 5,168 opioid overdose deaths in 2020, an average of 14
Echo, bring me my charger.
continue to die each day. Wow.
Oh. Echo.
Harm Reduction Network. Syringe exchange programs, yeah. So usually your state department a lot of times does it. I know it says it up here for PA. Department of Health. All right, I think I'm gonna stop the recording.
Thank you. Oh, dang it.
Nice close up of your face.
Sorry.
No,
My
you're good.
phone's about to die.
I'm gonna
There we
end
go.
the recording so you and me can chat.